Alright, so now today we're going to study about general pharmacology. First of all, before going into anything, we should know about what pharmacology is. Like, what is its definition, right? So, what is pharmacology? As we all know, logy means knowledge, like if you want to learn something, and pharma is drugs. So, if we do it like this, logy, knowledge, and pharma, drugs. So, together you'll come to know knowledge of drugs or study of drugs. So it is that branch of science in which we're going to study about the drugs and its effects on the human being. For example, like if you guys are sick, right? So your moms or your parents or you take certain type of medicine, right? And what that medicine does, it tries to break down your fever and you become healthy and happy again. So now if you want to study that which medicine to take when going in fever or going in stress or having a heart attack, some heart problems, BP, sugar, all of that deals with pharmacology. Second is, what is a drug? Drug is that substance that is taken when a person is in a disease state. Like when a person says, I have ankle pain, I have a hand pain, I have arm pain. Then the doctor will give a drug to that patient or to that person to increase and help in it and make him feel better. That substance is called as your drug. Now, the two most important terms for related to pharmacology are your pharmacokinetics and pharmacodynamics. What is a pharmacokinetics? What the body does to that drug. When a person will take the drug, how the body is going to deal with that drug and how the drug will then move in the body, like how the body will absorb that drug, will distribute a drug to the different parts, which will give it to perform its function. After function over, how it excreted out. That whole involves pharmacokinetics. For example, I am sick, I'm going to take a pill. That pill, how that pill will be absorbed by my stomach or by my different organs, then how from that it is going to go to my hands, my arms, my lower limbs, my thorax, abdomen, etc. After this, performing its function, how it will then enter into our kidneys, our liver, and from there how it will be excreted out. That whole is result in pharmacokinetics. Pharmacodynamics is what the drug will do to the body. If I take Brufen or I take Panadol or I take azithromycin, Azomax, or I take anything, folic acid, everything, what it will do to my body, that will result in pharmacodynamics, right? It's action, how the drug will then act. For example, if I have insulin, take an example, I have high blood sugar, right? So I will take insulin. Now, how that insulin is going to affect my body, it is going to call my different cells to take in glucose, decrease the blood glucose level. That will all result in pharmacodynamics. What is pharmacy? Pharmacy is that technique or that branch of science in which we will study how that drug is produced. What are the different substances which we're going to mix, combine together, sterilize it, standardize it, everything to make a drug that is called as pharmacy. Then we have next, that is therapeutics. What is therapeutics? Those are the drugs which are given for the treatment of any disease. Those drugs are called therapeutics. Like, for example, I have high blood pressure, right? So if a drug will be given to me to treat my blood pressure, that drug will be called as therapeutics, right? What is chemotherapy? It is also a drug that is required to kill any sort of very chronic diseases or cancer disease. If you have cancer and you are like in the first stage, second stage, it can be treated. Then the drugs which will be given to you to treat it, those are called as chemotherapic drugs, and the technique is chemotherapy. Then we have toxicology. Toxicology is that branch of pharmacology in which we study about poisons, like when you take very high doses of certain drugs, you become addicted to it, or they cause adverse effects to your bodies. And also there are certain poisons as well. If you take it, what will it do? It will damage your body, everything. So the branch in which we study about toxics, those are called as toxicology. Then we have clinical pharmacology. Clinical pharmacology, obviously, what is we're going to study? We're going to study in clinics, pharmacokinetics and pharmacodynamics. We're first going to give the drug and tell them to take this and see how that drug affects that person. Both pharmacokinetics and dynamics, that is resulting in clinical pharmacology. Where essential pharmacology are those medicines which are responsible for your healthcare majority of the population. What does that mean? Is that, for example, persons are anemic. Now, anemic patients are not only in one country. It can be in my country, it can be in your country, it can be in other countries as well, all over the world. But there will be a drug that will be present not only in my country but in all other countries to cure that problem. For example, anemia. So folic acid medicine will not be only present in my country, it will be present in your countries, in other countries as well, to take care and cure anemia all over the world. Those medicines which are not available in your country but also in other countries of the world to satisfy and to cure the health problem, those medicines are called as your essential medicines, like your folic acids. Then we have the next medicine that is called as your orphan drugs. Orphan drugs are those drugs which are very rare diseases, like you don't even know, they're not so familiar, and you from like 1 out of 100% of people may have it. And in order to treat those diseases, we have orphan drugs. Then we have the non-prescribed drugs, which you can get without the need of a doctor. Like the doctor doesn't have to prescribely, specifically write it for you to get it. Like your Brufen, Panadol. The doctor does not have to write it that this patient requires Panadol, so please give this Panadol to him. So those drugs are called as your non-prescribed drugs. Now there are certain drugs which have to be prescribed by the doctor, and then and only then can a medical store or a pharmaceutic or a pharmacy will be able to give it to you. Like your antidepressants or your antipsychotics. Like if a person is psycho, obviously if he cannot just go and get a medicine, the doctor has to prescribe that specific disease type medicine, like if he has epilepsy or if he has dementia or bipolar diseases or OCD, EDC, whatever diseases they have, right? So the doctor has to prescribe those specific medicine to cure that specific disease. Then and only then the pharmacy will be able to give. Those drugs are called as your prescribed drugs, right? So that was all for the definitions of pharmacology, and later we're going to now study in detail about them. So I hope that you guys got an idea and helped it to understand. If you guys have any questions, leave it in the comment box and give my channel a thumbs up. Thank you.